The last thing that anyone wants to see in this pandemic is another lockdown.
Powerful reality of our circumstances, we can't wish it away.
But with the pandemic, which as yet has no treatment, no vaccine, and can be spread by people who don't have symptoms, there's only one thing that we know works, and that's separating us as much as possible from each other.
The number of people we encounter is a really important driver of disease transmission. And then the other thing is the duration of time that we spend with those individuals and the type of contact that we have with those individuals.
The really tricky part is recognising when you're losing control. One measure is what's called the effective reproduction number, and it's changing in Victoria and New South Wales.
The effective reproduction number is the number of new infections we would expect from each case. And when that number is above 1, that's indicative that the outbreak is growing. When that number is below 1, the epidemic is in decline. A few days ago, we estimated that the effective reproduction number in Victoria was around 1.3. So for every 3 cases, we would expect around 4 new cases. New South Wales, that number is also estimated to be above 1 at the moment, indicative of a growing outbreak, which is of concern.
What determines the effective reproduction number is social and physical distancing. Dr Freya Shearer and her colleagues at the University of Melbourne constantly monitor how well we comply with these measures. And that's how they know the potential for the virus to take off in each state. So for example, at the beginning of July, Victorians were actually better at distancing than people in New South Wales and other states. On the 1st of July, the number of people Victorians came in contact with outside their homes each day was just under 6, whereas in New South Wales, Queensland and WA, the number was between 8 and 9. It's another reason why New South Wales is worried about its outbreaks, and other states can be complacent. Lockdown is really the only tool state governments have left when testing and voluntary distancing fail to control an outbreak.
What is potentially concerning about the uptick in cases that we're now seeing in New South Wales is that transmission potential is it's estimated to be quite a bit higher than, so above 1, than what we estimated in Victoria. Because we're estimating that the population in New South Wales on average is mixing more than Victorians were mixing.
Please make sure if you've been told to isolate at home that you spend 14 days at home, even if your test comes back negative.
Which brings us to masks.
Victoria has taken the unprecedented step of making masks mandatory.
Now it's compulsory for everyone in Greater Melbourne and the Mitchell Shire.
Masks work. They can reduce transmission by around 70% and have been underutilised in Australia largely because the group advising the National Cabinet has in the past offered qualified support for their use. The Victorian government has now mandated masks for Melbourne and Mitchell Shire, but New South Wales is leaving it up to personal choice.
If you cannot guarantee that people around you respect that social distancing, you must consider wearing a mask.
A dramatic example of mask effectiveness comes from Springfield, Missouri, where 2 hairstylists who were positive for COVID-19 saw 139 clients over a period of about a week. The stylists followed the city rules requiring hairdressers and clients to wear masks, and no documented infection was found. But one of the stylists did pass the COVID-19 virus to her family at home, where mask rules didn't apply. And for everyone trying to work out how to wear one of these properly, here's a reminder. Wash your hands. Hold it by the sides. Don't touch the mask itself. Put it on over your nose, under your chin, and behind your ears. And to take it off, you do the same thing. Don't touch the mask itself. Take it off from behind your ears, put it down, and wash your hands again. It's as easy as that.
Hi, I'm Lee Sales. Thanks for watching this story. If you'd like to watch more of 730's stories, they are on the left of your screen. And tap on the button below to subscribe and get the latest from ABC News.